Welcome to Maxill's Reality Corner, a series of discussions bringing reality from dental practices supporting our Maxill customer. My name is Michelle and I am here at Maxill and a dental hygienist working in the IPAC department in continuing education.
My name is Nicole. I'm with Maxill in regards to IPAC compliance and helping out offices as best as I can.
Our topic today has stemmed from many emails, many questions that Nicole and I have. And one of the common base was stress and pressure in the dental practice brought upon by so many changes, so many quick changes in our new, what we call our new norm in this pandemic that's unfolding.
If we begin with one of the common emails or calls that come in, is keeping stock of the needed PPE. We all know there's a shortage across the board for isolation gowns, bouffant caps, shoe covers, gloves, the whole 9 yards for PPE. It's great to keep quantities to a maximum so that there is no shortage across the board for dental hygienists, dental assistants, and even doctors. With all the changes, with all the regulations, we all know that nobody can agree to disagree right now with PPE. To keep an inventory of stock limits per week, maybe the suggestion would be to go from dental supplier to get the quantity per item that you are able to get and go from there. Order from multiple vendors for now. Watch social media to watch for deals so that you can catch the deals while they're still active and that there's no shortage of inventory. Watch staff usage, possibly save on how much each dental assistant or dental hygienist is using on a per patient, per hour, or per day basis. Gowns, masks, and the correct levels need to be documented for your charts to make sure that what you're actually ordering is the levels that you actually need to have to practice properly for aerosol generating procedures and even non-aerosol generating procedures. That's one of the first emails that's come our way, is keeping stock of the needed PPE and never running short on anything you need to practice safely.
And it plays a large role for stress, the person who's ordering, because that is not the traditional, because on our topics that we're talking about involve practice management. So this is not usually how the ordering department of a dental office works. So you would have plenty of time to place an order in. Maybe sometimes you would have 1 or 2 items that's on back order, but usually it's not a problem. But now
there's a real shortage.
Yes, so then the person who's doing the ordering, well, usually is also a dental assistant that is working and assisting. They've got a lot to do to go back and check, is the inventory there, when's it coming in? So then the stress really adds up. And then you have their whole team, asking the dental assistant, where's my gowns? When are we getting the box of masks? So that's very, very stressful. So I think a little compassion and understanding within the team has to be there. And as Nicole defined, we'll have no choice. We're going to have to go vendor to vendor to keep that stock up. With that also comes the layers of PPE, and it is warm. So that adds stress and frustration as we're placing all these layers and we're trying to do our regular job. It becomes very, very hot and you're not moving the same way. The stress is there, obviously, in trying to accomplish our task. The stress is also there because we have the administrative team who doesn't have the same layers, who is probably freezing temperature-wise, and then the clinical team who is constantly hot. And that becomes a very long day to have to work within that dynamic. Nicole also mentioned the documentation of the PPE. So absolutely, so if your chart says that you have performed an aerosol generating procedure, then your PPE has to match that. So your level of gown needs to be written in your documentation. And that would be dependent. We have different geographical areas tuning in for our reality corner, dependent on your geographical area, but in having to know the documentation or your record keeping guidelines, not just your infection control guidelines.
Or even as to when the gown needs to be worn, where it can be worn can be stressful because not every office runs the same as they follow the IPAC guidelines. So make sure you know your IPAC guidelines as to where and when you need to wear your isolation gowns.
And the masks, because we were always told that you are not leaving your cubicle with a used mask. Now we're walking around with our masks. You might be greeting your clients in the parking lot with a mask. So even that, you're completely stepping out of our normal boundaries for infection control. So that puts us at even added stress, more stress on top of what we already have.
It's a huge learning curve and we will all get through this.
Absolutely, exactly. And we hope that that's what we're bringing with the reality corner is some sort of support. And I would have to add that Nicole and I are no strangers to the experiences, as we both still practice clinically. So we know we've been in these same situations and having to make all these decisions. And it would be wonderful in practice management if making all these decisions were always when we have the luxury of time. We know that it never happens that way. It's always when you're running behind, there's other things happening as well. So it's an even adding more to our stress. And then we have our downtime with patients. I'm going to have Nicole talk a little bit about that, and then I'm going to reverse it after she's done to the what do you do when there's no downtime.
So with downtime, we all have a limited number of patients that we're seeing now compared to we did 6 months ago or a year ago. So we have a lot less inventory going through for patients. Limited on patients' PPE as well, so we're not having to have the isolation gowns per patient because we really don't see the same numbers we would before. There's a huge financial loss for the staff as well as the doctors on limiting the number of treatments that we're doing in a day-to-day for aerosol generating procedures. Possibly use the downtime between patients to update public health online modules, as there is currently 19 up-to-date modules that need to be completed by the entire dental team. That's admin, the dental clinic in the reprocessing, as well as the doctors, all need to have their IPAC online modules up to date, printed certificates. That would be one aspect of keeping control of your downtime. Clean up any declutter in your practice to make sure that there's any areas that need to be organized, decluttered, any debris that can be removed that doesn't need to be in the practice. Make it a sterile environment for yourself as well as your patients. That would be a good way to reduce any downtime. You can also keep up to date with your logs, making sure that your logs are up to date, current, possibly filled out as best as you can, and then make sure that it's compliant and kept for 10 years. IPAC training for every new staff member as well as old staff members. Make sure that you're up to date with your IPAC guidelines, and new staff members also need to do their IPAC online modules. It's really important that if you don't have an IPAC manual, then maybe you investigate with your downtime as to where you are with your manual. Do you need help with getting your manual started? That's a maxill product that we would be happy to help you out with. It's an IPAC 360. If you want to call, we can help you out with setting up an IPAC review for you as well.
And I will then comment on the reverse, because we're seeing, and it's interesting the questions that are coming in, where some offices are a little slower, or they had to have everything in place to begin. So some began back in June, some are just starting up now. So we've got everything and anything. So there might be some downtime. Now what happens to the office that is the reverse? That there's no catching up, there's no downtime. So we're back to back with clients. You might be seeing maybe 1 or 2 clients less. You'll still have especially like Nicole's saying, if you're doing an aerosol generating procedure, you're still going to have to adhere to the air changes per hour, the fallow times, all this new air quality that we're adding to our environmental control. So when there's no downtime, then what happens? When do you stock the room? When do you go check with the person who's ordering, what do you have for your inventory? Mm-hmm. So personally myself, I'm finding that I'm arriving to work much sooner than I ever did.
And leaving later.
Yes, and staying later and later. So I think that's the reality. That does that put stress on you at work? Absolutely. Does that put stress on your family as well? Or whatever you had that would have been your normal life, or normal, I guess you could say, plans after work. So it's shuffling all that. So perhaps as well, when you come to work midweek, end of week, you're going to be a little more tired. You've had to deal with all the different stresses we've already talked about, and you're going to have to somehow juggle all that within your life balance. So we can see where the stresses are coming from. So the no downtime is as equally difficult as the downtime, because we're going to have a different plan. And I think it's interesting because as dental professionals, well, we kind of knew what we were signing up for. We know dental. We're also all maybe a little OCD because we've had routines in place that have never failed us for practice management. We've had all these wonderful systems, and one has been changed, mainly IPAC, but it has had a domino effect. It has trickled down and impacted all the other systems as well. So time management and time efficiency has been a big one for sure. Absolutely. Mm-hmm. And then we have also touched upon, is your office compliant with infection control? So that has been a big, well, startup. So you couldn't even step into your dental practice without having a series of checklists in place, without obviously knowing what you were stepping into. And that's one of the nice services that if you're unsure, if you are, or maybe you have an IPAC program in place, and again, you're unsure if it meets the criteria, you're unsure if you even have one that's fully in place, then that's when we can certainly support you. And again, the service that we offer for infection control has been researched and written from the perspective of being in a dental office. So it's not only theory based, but it's an application.
It's being in the trenches of your everyday life. It really isn't black and white. There is that gray area in order to be compliant, but actually get your job done correctly and everybody stays safe. I find for me the big stressor for IPAC right now is going into help offices is the logging system. So making sure that the time is spent to accurately log and document it, and that those logs are kept either in a paper form, in a binder, or scanned digitally and kept for 10 years. So for me, my perspective to help you out with de-stressing is to make sure that you take the time to make sure that your logs are up to date and accurate.
And we've been chatting so far more so about the existing team base. And as Nicole was mentioning, the logging and more about the whole quality assurance system of record keeping, how about the temping individual? So a temping assistant, a temping dental hygienist. You may not know what office you're stepping into. So I would certainly say we've had to do the homework before stepping into those offices, because you can be going into an office that's compliant or one that is not. You do not know the level of PPE that's available, but you should. So these are the things as well that if you're more of a temping based functionality within the profession, you would have to do your homework and your research, and who's the temping companies that you're with. Have they done some of that legwork for you? Do you call the office ahead? Important information. One thing as well that I noted a couple weeks ago that maybe we're not thinking of is if you're temping, going into an office and then wearing an N95 mask, you must have a fit test for that mask. So if you're arriving and just going to wear whichever mask is offered to you, that's wonderful that the supply is there, but you specifically may not have been fit tested for that mask. So you may have to do that part of the homework as well, right?
For myself, I temp still as a dental assistant, and being extra small, not every office is going to carry the extra small gloves or even extra small. So be honest, I do supply my own gloves when I do go into temp agencies to make sure that my PPE actually meets my size.
Mm-hmm. And number one would be that you'd have to keep yourself safe.
Mm-hmm.
So adding to that stress, again, right? So we've got stress upon stress, and because your safety is crucial, in not just prior to COVID, but obviously with COVID and all around, right? It's from the routine practice perspective, which is our next topic. So the risk of disease. So are we fearful? We could say that yes, we're cautious. I don't think that dentistry has failed us in routine practice.
No, really, it's stayed the same because, you know, it's been standard precautions or universal precautions for years. We just maybe have a little bit more of a fear because it's newer than it's been since AIDS or tuberculosis, where it was 20 years ago.
Exactly. Nicole and I might show the era into when we started practicing, but we do recall when masks came about. And yes, we had some lovely areas where we kept masks and we reused the same masks all day long. So we've already seen some of our changes, and maybe it would be the mindset of how do we envision our routine practice as pre-COVID to COVID times, and that's where the term additional precautions come into play. So maybe thinking that all we're doing to routine practice is adding a couple layers, right? So when we say, you know, the catchphrase, you got this, you really do. You really got this because your base and infection control was always there. Mm-hmm. And then we come to working together as a team. And supporting each other is going to be huge. Trusting into one another as well, that the jobs that we're doing, we are trying to fulfill our jobs. So please do not be angry at the person who does the ordering. They're only able to do what they can.
Right. Same in the sterile bay and the reprocessing. You have so many tasks to get done to make sure that those instruments are at 100%. You've not missed a step. So that it's good that everybody works together as a team. Everyone has the same policies and procedures, so that the same set of instruments is done the same way for whoever's responsible in the reprocessing. Everybody's on the same page doing the same tasks.
And Nicole and I were chatting before we came on camera. One of the things we were talking about is that in our support that we're not going to bring our colleagues down.
Right.
So maybe if there's something that is not yet finished, or from a time management perspective, this is where we're having to step it up, and realizing as well that our days, if your shift was 8 to 5, you're probably now looking at a 7:30 to 6 o'clock. That's possibly the reality. So that we're not bailing out, especially at the end of the day, for our team when everybody else needs that support.
Right. Everybody kind of is able to work together to get out at the same time. If you're able to step it up and maybe learn a new task that you weren't maybe responsible before, to help out the dental hygienist or the dental assistant to have her room closed so that everybody can leave in a reasonable time to go home safely to their families.
Absolutely. And then we will end up with our last note is be kind to yourself. So back to us being a little OCD, we are hard on ourselves. We have come this far in our profession and in our, obviously in our roles within those job descriptions, because we want to do the best. So that's an interesting dilemma for dental professionals, that in aiming to do our best in times of uncertainty, when the facts are changing constantly, we've made a decision maybe last week, now we're changing it to something else. And maybe we beat ourselves up a little bit. We're hard on ourselves.
Yeah, it's hard to be perfectionist at this time in the world with it changing, the regulations changing almost every week it seems. It's hard to keep on top of it, but just be kind to yourself, take it easy, and do the best you can.
Thank you. Thank you for joining us on the Maxill Reality Corner. We would like your feedback. We would like some topics maybe that you would want to hear. We've got plenty coming up, so this is going to be ongoing, a series. So please join us again, and thank you for being the amazing dental professionals that you are.